poor people or people who do not have insurance utilize emergency rooms for primary health care. Well, in the emergency room, it's extremely expensive to go, because first of all, the doctor does not really know the patient, and because the doctor doesn't know the patient, and because we have to practice some defensive medicine, if you will, all kinds of labs will be ordered, all kinds of x-rays will be ordered, and that drives up the expense and so forth. So our goal is to have multiple access points so patients without doctors can come to these sites and have what they call a medical home. So these patients will be familiar to our doctors, and we do a lot of preventive care. In fact, that's one of the big focuses of these types of health facilities or health organizations, is we do primary preventive care, so that these folks don't go to the emergency room for a cold or for a splinter or whatever. They can be taken care of at a clinical setting, which is much cheaper than going to the emergency room. So that is a major savings within any community.
Approximately how many patients do you see that are, in effect, uninsured or underinsured?
Collectively, at all three of our current sites, our uninsured population makes up close to 40%. So the rest, about 95%, are right around the 200% federal poverty level or below. So we do have a lot of folks that's on Medicaid as well as Medicare. And there's a few, especially in the Youngstown site, that we have quite a few insured patients, primarily because we're next to the university and we have university professors and students that's on their parents' insurance that will utilize our facility here. So again, the focus here is to provide health care to the medically uninsured and underinsured. However, we also do need to see these Medicaids and Medicares too.
As health care reform is being knocked about right now in Congress, how is that going to impact your operations, and your thoughts on that?
I don't know if anyone's really read the entire proposals, and my understanding is there's several proposals out there. But all the proposals are very favorable for these community health centers, because they do know that we do provide a vital role in accessibility to health care for the poor. So my understanding is the bills do contain language in which there is more support for our types of community health centers. And I believe, I'm going to be biased here, but I believe that we do a good job collectively throughout the country. And I believe this is a partial answer to some of the health care issues that we face these days.
BusinessJournalDaily.com 3 Minutes with Dr. Ronald Dwinells, CEO of One Health Ohio. Sponsored by C&V Wholesalers, residential, commercial, and institutional plumbing distributors.